Welcome back to the deep dive. Today, we're going to crack the code on a really simple, but honestly vital health check you can do.
The cholesterol blood test.
Exactly. Our mission is to give you a quick guide on the scientific why it all matters, and crucially, the where and how if you happen to live in the Dorchester area.
Yeah, we're basing this on a great resource from Blood Test UK. It's their cholesterol blood test in Dorchester, your health guide. We're really just trying to simplify it.
Right. Break it down to the central question. How does this simple blood draw give you such powerful protection for your heart?
It's a great question.
So let's start with that alphabet soup you mentioned. What is this test actually tracking? Because it's more than one kind of fat, right?
Absolutely. It's measuring a few critical things. First, you've got HDL. We call that the good cholesterol.
Okay.
Think of it like a little cleanup crew, taking extra fat away from your arteries.
And then there's the bad guy.
Then there's LDL, the bad cholesterol. If that number gets too high, it starts sticking to your artery walls, building up this sort of sticky gunk.
And if that gunk or plaque builds up, it's like a blockage in a pipe. That's a direct path to things like a heart attack or a stroke.
Precisely. And the third piece is triglycerides, another type of fat. But the real danger here is that this whole process is silent.
No symptoms.
No symptoms at all until the problem is really severe.
So if you feel perfectly fine, how do we get the message across that you need to act now? The source suggests most healthy adults should check every 4 to 6 years. But that timing speeds up if it runs in your family, maybe even annually.
Yes, that's why screening is preventive armor. And if your GP says you need more frequent checks, you need to know where to go.
And the Dorchester area is well covered.
It is.
So let's get right into the logistics. For people using the free NHS service, where are they headed?
Okay, so the local GP surgeries are your first stop. You've got Bridge Surgery, the Grove Surgery, Fordington Surgery.
Poundbury and St. Mary's Surgery are on that list too, from the guide.
Yep, and Dorchester Medical Practice as well. Plenty of options.
What if someone wants to go private? Maybe for speed.
Then you're looking at places like Dorchester Health Clinic or Weymouth Private Clinic. Of course, while the NHS tests are free, these will have a cost.
Right, so what sort of cost are we talking?
The Blood Test UK guide puts it in a range of about 30 to 150 pounds.
Okay. And there's a really critical prep step we learned about, the fasting.
Yes, this is so important. You often have to fast. That means no food, no drink, just water for about 9 to 12 hours before the test.
And that's to make sure you're getting a true reading, isn't it? Not just the fat from your last meal.
Exactly. It separates what's temporary from your real systemic risk profile. You have to measure the consistent levels to know what to do next.
Which makes the results infinitely more powerful. Once you know your numbers, you can start making real changes.
Yes, and that payoff is huge. It's the difference between just getting advice and understanding why it works. Take the Mediterranean diet, for example. It's not just healthy. The good fats in it actually help raise that protective HDL, your cleanup crew.
So it makes the cleanup crew more effective.
You've got it. And exercise, aiming for about 150 minutes of brisk walking a week, that helps your body clear fats from the bloodstream.
Again, boosting the good cholesterol. Yeah.
And of course, quitting smoking is it's one of the biggest single changes you can make.
And if that's not enough?
When lifestyle changes aren't quite enough, medication like statins might be the next step. But the whole goal, the test, the fasting, the changes, is to lower that risk of a major cardiac event down the road.
So the bottom line is, this simple test is accessible, it's actionable, and it gives you essential data for long-term health, with lots of local resources in Dorchester.
It really is. And I'll leave you with one final thought to mull over. Remember that high cholesterol can be a deeply genetic issue.
So you can be doing everything right.
Exactly. Sometimes your levels are high despite a perfect lifestyle. So if heart disease runs in your family, knowing your numbers early isn't just a good idea. It's probably the most critical form of prevention you can possibly undertake.